Good afternoon. Thank you very much for being here. Want to just touch on what our priorities are going to be for this next week. We are seeing really devastating outbreaks across the country. Numbers are rising. People are deeply worried. We're seeing outbreaks in long-term care homes, and the devastating impact of those outbreaks means that we're going to see loved ones being lost. And we have to do everything we can right now to stop that. The numbers are rising, and we need to stop those numbers from increasing. We've shared some stories about what's happening in long-term care centers. We talked about what's happening in Winnipeg, one of the hardest hit communities right now. It is heartbreaking to hear stories of the treatment of people in long-term care homes, particularly when we knew that this was not a surprise, the second wave. So there has been a wholly inadequate response to the second wave, and we need to really get down to doing some serious work to stop the increased numbers. We're also seeing deep concerns in Nunavut, and I'll be having a conversation with the Premier of Nunavut to talk about the support that needs to be there to prevent the outbreak spreading in Nunavut, which could have just horrible impacts on a community that is already underserved, underfunded, and under-resourced. We know in general, Indigenous communities are seeing outbreaks with high rates of infection now. Again, these are communities that have historically been under-resourced, underfunded, and they will see a very devastating impact if we don't act now. We also want to continue to put in place help to small businesses. I've spoken with restaurant owners, I've spoken with small businesses who are saying the help is too slow. They needed this help months ago, and the Liberal plan to make it tenant-focused or make it landlord-focused instead of tenant-focused has meant that small businesses have forced to shut down, and many of them will not open up again. We need to accelerate the help to small businesses immediately. This is another massive concern. And today we want to talk about our private members bill. We have seen in this pandemic that people lost their jobs, they also lost their benefits, and more than ever, it means that they cannot afford their medication. And so our push for a universal publicly funded Pharmacare, where if you need medication in this country, you should use your health card, not your credit card, is more important than ever. This bill that we're putting forward is more important than ever. We've seen decades of inaction on the part of the Liberal government, broken promises since the 90s. We cannot continue to force people to make the impossible choice between buying their medication or fundamental life costs and expenses like heating their home. There has to be some action on this. And that's why our bill is a step forward. It is a clear step forward for the government to support us in getting this dream and idea of a universal publicly funded Pharmacare for all into reality. And we're laying out the framework for that. And this framework will help us take that first concrete step forward. The Liberals have talked about it, but no concrete steps. Here's a concrete step. This is exactly what their own commission and multiple committees have recommended, having a framework like the Canada Health Act. And my House Leader, finance critic, and Member of Parliament for New Westminster Burnaby will get into more details on the bill that he's presenting on behalf of all New Democrats and talk about those details about how it mirrors the Canada Health Act. But this is fundamentally important in this time. Donc, je veux commencer en disant que c'est un temps difficile maintenant. C'est tellement difficile parce que les nombres de cas de la COVID-19 augmentent. Les gens ont peur pour l'avenir. On a vu des situations horribles dans les centres de soins de longue durée. Et tout ça a été prévisé. On savait qu'on va avoir une deuxième vague de la COVID-19, mais le gouvernement fédéral n'a pas mis en place un plan pour réagir à cette réalité. Et maintenant, la réalité est grave. Les situations sont tellement graves dans les villes comme Winnipeg, dans la région de Toronto et les banlieues. C'est une situation horrible pour Nunavut et aussi dans les communautés autochtones. Donc, il faut agir. On va aussi continuer de mentionner l'importance de donner l'appui aux petites entreprises. Ça, c'est aussi quelque chose qu'ils ont dit. Ils m'ont mentionné l'importance d'avoir l'aide tout de suite. Et sinon, ils vont fermer les portes et peut-être jamais réouvrir. Donc, c'est une situation tellement difficile pour les petites entreprises. Et finalement, on propose aujourd'hui on propose un autre projet de loi sur l'assurance médicaments universelle et entièrement publique. Plus que jamais, c'est important que si quelqu'un a besoin des médicaments, ils ont la capacité d'acheter ces médicaments. Ça, c'est primordial parce que quand les gens ont perdu leurs emplois, ils ont aussi perdu leurs bénéfices. Ça veut dire plusieurs Canadiens ne peuvent pas acheter le médicament. C'est une situation grave et c'est tellement important qu'on fait quelque chose de concret. Le gouvernement libéral a parlé de l'assurance médicaments souvent, mais ils n'ont jamais mis en place des actions concrètes. Voici un exemple de quelque chose qu'on peut faire concrètement. C'est un projet de loi pour encadrer comment on peut aller de l'avant avec une assurance médicaments universelle. C'est un projet de loi qui suit les principes de la loi sur la loi canadienne sur la santé. Donc, je présente mon leader parlementaire et mon ami et député pour New Westminster Burnaby qui va donner plus de détails sur notre projet de loi. Merci, Peter Julian.
Merci beaucoup, Jagmeet. Alors, le projet de loi 213, on débute les débats là-dessus ce soir, puis ça va être un processus qui va continuer pendant les prochains mois. Je vais y revenir. Mais effectivement, qu'est-ce que ça met? C'est un cadre légal autour de tout ce processus de développer un programme national d'assurance médicaments. Le processus légal est effectivement encadré par les 5 principes qui existent déjà, comme Jagmeet a si bien dit, dans la loi canadienne de la santé. Ça veut dire la gestion publique. On parle pas pour profit, mais la gestion publique de ce programme. On parle aussi, bien sûr, de l'intégralité et l'universalité d'accès pour les Canadiennes et les Canadiens. Et puis aussi, on parle de la transférabilité et l'accessibilité à ce programme-là. Alors, ça, c'est les 5 principes qui sont encadrés là-dessus. Les besoins sont criants. On parle 2 millions des Canadiennes et Canadiens qui doivent choisir entre mettre la nourriture sur la table ou chauffer leur maison ou payer leurs médicaments. Et ceci ne peut pas être permis de continuer. Alors, effectivement, qu'est-ce qu'on débute aujourd'hui? C'est les débats qui vont continuer jusqu'au mois de février, quand les députés partout au pays vont être appelés de voter sur le projet de loi 213. Et là, on demande aux Canadiennes et aux Canadiennes, les 8 millions qui n'ont aucune couverture, de contacter leurs députés. De dire à leurs députés comment c'est important d'avoir ce programme national de médicaments. C'est extrêmement important qu'on réussisse après une génération des promesses brisées là-dessus. So I'm very pleased to speak today on Bill C-213, which is the National Canada Pharmacare Act. The debate will start tonight and will continue over the next 3 months, and I'll come back to that in a moment. What this does is provide a legal framework for the government to negotiate with the provinces. And it's based, the legal framework is based on the 5 principles that exist already in the Canada Health Act. That means public administration of this program. It means comprehensiveness and universality in terms of people being able to access the program, and portability and accessibility in the program as well. These are the 5 principles that govern the Canada Health Act. These are the 5 principles that would be carried forward in the Canada Pharmacare Act. Now, we know that up to 1 million Canadians have to make that desperate choice between putting food on the table or heating their homes or paying for their medication. There's about 8 million Canadians that don't have access to any sort of program to pay for the medication that their doctors prescribe. So this is an urgent need. It's been over a generation since we've had promises around Pharmacare. Now is the time to bring it to reality. And so what we'll be asking Canadians over the next 3 months, because the vote will be held in February, and MPs will be taking that second reading vote that agrees in principle with the Canada Pharmacare Act and then brings it to committee and then back to the House. We'll be asking Canadians who care about this, and we know that there are many out there, to contact their members of Parliament and to say to their member of Parliament, you should be voting yes on C-213. Tommy Douglas always envisaged that we would move from universal health care to universal pharmacare, and now is the opportunity for Canadians to have that voice, to give voice to their members of parliament, and members of parliament to vote yes on 213. So with that, I'll ask, are there any questions? Est-ce qu'il y a des questions?
So, nous allons maintenant passer aux questions, commençant par les questions au téléphone. Comme toujours, une question suivie par journaliste. We'll now take, starting with questions on the phone. As always, one question, one follow-up per reporters. Operator, do we have a first question?
Thank you. Merci. For questions, press star 1. Pour les questions, étoile 1. We have a question from Tom Korski from Blacklocks. Line open.
Thank you. Mr. Julian, technical question about your bill. Is it withholding any cash transfer to provinces that don't comply with the universality, or just specific health cash transfers?
No, it is withholding those transfers, the same kind of structure in terms of the Canada Health Act.
Understood.
Yeah, so if they're not meeting the principles, then the Governor and Council would have the ability to refuse the transfers.
So transportation, fisheries, any other funding is not affected. Understood.
No, just Pharmacare.
I wanted to ask you, Mr. Julian, about the politics of this. The chief actuary the other day published a report, said in 2023, for the first time, Canada will have more seniors than children. It's an astonishing statistic. Everyone knew that was coming. Do you see the day that regardless of which party is in power, regardless of whatever lobbying goes on by Canadian Life and Health Insurance Association, that you will have such a block of seniors who are extremely politically active, enthusiastic voters? They're not all either poverty-stricken or millionaires such that they would qualify for subsidies or would not need any to purchase medication, that some sort of Pharmacare program is in the cards. It's inevitable. Can you comment?
I think it's inevitable for many reasons. As you know, the Parliamentary Budgetary Officer has actually estimated that Canadians as a whole would save about $4 billion by moving to universal pharmacare. Part of that is because of the negotiating power and clout that comes from a national pharmacare program. New Zealand has found the cost of some of its medications reduced by 90% because of that collective buying power. So Canadians as a whole benefit from that. Canadians are not covered, 1 in 5, but Canadians who are covered are still paying billions of dollars in additional costs around medication because of the absence of national pharmacare. And I'll add one more element that's really important. It's the competitiveness of our businesses. Now, universal health care is about a $3,000 competitive advantage for each employee hired in Canada as opposed to a company competing with an American company. The American company has to pay health care costs. The Canadian company doesn't. $3,000 per employee. The estimate around Pharmacare is about $600 per employee. So it's win-win-win. We lower the costs of medication to overall. Canadians have universal coverage that so many Canadians support. And at the same time, it helps to contribute to the competitiveness of Canadian businesses. It really is win-win-win.
Opérateur, prochaine question.
Thank you. Merci. Next question, Tessie Sanchi, Hill Times Research. Line open.
Hi, thank you for taking my question. I'll start off with this call to Canadians. It's interesting to me, so I'm just curious. I mean, you laid out the timeline. You have 3 months. What will NDP members of Parliament be doing over the next couple of months to really push Canadians to talk to their own MPs who may not be NDP MPs?
This is the chance to push to get this done. We have seen broken promise after broken promise from the Liberal government. We've seen inaction. They campaigned on universal pharmacare. We've got a pandemic where we're worried about our health, and still so many Canadians can't afford to take the medication they need. We are the only country in the world that has a universal healthcare system that doesn't include medication. The fact that people in our country can go into a doctor, get diagnosed, find out what's wrong with them, be prescribed a medication to get healthy, but then can't afford that medication is simply nonsensical. And so this is a time for us to mobilize people. And we're calling all Canadians, call your MPs. Let them know that you want to see universal pharmacare. It would save your family so much money. It would help people out. It would lift people up. It would give dignity to people who can't afford medication. We're going to be asking over the next couple of months people to call their MPs, let the Liberal government know that it's not enough to talk about this. We want to see concrete action. And we want to see that action so that we can move forward with this first major step, bringing in the Canada Pharmacare Act, which is what the government's own commission recommended as one of the steps to establishing universal pharmacare.
Okay, thank you. My next question is about the provinces. This really seems to be a bill that assumes that the provinces are just going to go along with single-payer universal pharmacare when we know that's not the case. What would your message be to the provinces?
Well, similarly, when we started moving forward with the universal health care, there was opposition initially. But everyone realized that we are better off when we pool our resources. We are better off as a country when we have a universal health care. But with medication, it's actually even more so the case. We have seen examples from around the world. It is very clear that when we pool our money, when we negotiate together, we actually get better prices and it lowers the cost for provinces. And similar to when we brought in universal health care, there might be some provinces that lead the way, that decide to join into this program first. And then as Canadians start to see that if a province joins, that every single person in that province can get the medication they need, and it's saving money for the province and for people and for businesses, it will then encourage other provinces. This is only going to happen if we work together. This is not about imposing a solution, but this is the best solution, and it will work, and it will save money for everyone. So we need to work together. We're only going to achieve this by making the case, showing how it works, and convincing people. And the first step to achieving that is to get this bill passed. This is a concrete step to set up the framework. This isn't forcing provinces. This is the framework that we can use to then negotiate, as Peter Julian pointed out, our House leader. This is the framework so that we can negotiate. This is what will be the framework that sets up a universal pharmacare.
Opérateur, prochaine question.
There are no further questions. Il n'y a plus de questions à ce moment-ci.
Nous allons maintenant prendre des questions dans la salle. We'll now take question from the room. David?
Hi, Mr. Singh, Mr. Julian, good afternoon. Thank you for taking our questions. David Thurn from CBC News. So let's just say you don't get support from the other parties, particularly the Liberals. What are you going to do about that? You have leverage in this parliament. What are you going to do to get this bill that's so important passed?
Well, really, I want to flip it back on the Prime Minister, on the Liberal government. Do they actually mean what they say? They've promised this for years. They promised it recently in the last campaign. They talked about it in the throne speech. So are the Liberals just talk? Because here's an opportunity to back it up. Really, I put it back onto the Liberals. I put it back onto the Prime Minister. If Justin Trudeau really meant what he said when he said that he wants to bring in universal pharmacare, his own commission recommended this step. For some reason, the government hasn't taken this step. We're helping. We're saying, well, here it is. We'll present it. We'll present what your commission has said is a vital first step. Lay out the framework with a Canada Pharmacare Act, first of its kind, as recommended by all the experts as one of the key steps. Now let's see if they actually mean what they're saying. And let's put it back onto Justin Trudeau and the Liberal government. Do you mean it? Well, here it is. Vote for it.
If you don't get the sort of response, Mr. Singh, that you're looking for from the Liberals, does this mean that you're going to withdraw your support for their minority government?
Well, what we're going to do is continue to find ways to fight for Canadians. And what I've done throughout this pandemic, what we've done as a team is every step of the way we've said, here's what people need, and we fought for it. And we've won again and again for Canadians. And so I haven't drawn lines in the sand. I've negotiated and we've fought and we've delivered for Canadians. And that's what I'm going to do. But on this one, it's really important. This isn't something that has come out of nowhere. This is something that has been at the beginning of our healthcare system, one of the gaps that has been identified. We're the only country in the world that doesn't do this. The Liberals have acknowledged that. They have said that this is important. Well, if it's important, vote for this. Let's move forward with it. Sometimes you hear when there's legislation put out that there's some sort of poison pill in it, or there's something that is some rhetoric that maybe the government doesn't agree with. This is a straightforward step forward to establish universal public pharmacare for all that we all know is the right way to go forward. The PBO has pointed out that this would save money. this is something that makes sense. I could not imagine why the Liberal government would vote against this unless they never meant it in the first place.
Mackenzie?
Mr. Singh, Mackenzie Gray with CTV News. In Vancouver today, Kennedy Stewart has announced that he's going to put forward a motion at City Council calling for the decriminalization of personal possession of illicit substances. If that passes at Vancouver City Council, they'll then submit a request to the federal government to have that happen in Vancouver. Is that something that you support?
I've long supported this. Let's make it really clear. When we are looking at how people are struggling with addiction, and people who are found in possession of small amounts for personal use. These are people that are dealing with addiction, people that are dealing with mental health, people that are dealing with poverty, or maybe all three. None of those things are criminal justice problems. They are healthcare problems. And if we want to save lives, if we want to help people, then we should respond with a healthcare response instead of a criminal justice response. So I've said this again and again. To save lives, we have to have a compassionate response. And a compassionate response to people dealing with addiction, people dealing with poverty, people dealing with mental health is with healthcare, not by putting them in jail.
Pre-pandemic, obviously, your party had been pushing a universal pharmacare plan, but since then, we've racked up an incredible amount of money for various programs. And in that period of time as well, the provinces have come forward and pushed for more direct transfers from the federal government to go specifically to healthcare, to run hospitals, to do the services that at this point in time, premiers say they can't effectively do. So how can you convince premiers, and why should money be spent on a national pharmacare program instead of that money going into what many premiers would say is a broken healthcare system already?
Well, we need to do both. There's absolutely no question about it. We've seen successive Liberal and Conservative governments cut healthcare funding, and that has starved our healthcare system. It has made it harder for provinces to deliver the care that they need. The agreement used to be a 50-50 split, and over the years that has eroded to something that now looks closer to 25% from the federal government and 75% from the that's on the shoulders of the provinces. So it has become very untenable. So we absolutely need to do both. But let's be very clear about the Pharmacare. The idea that everyone should have access to medication would actually save our healthcare system money. It would save provinces money. It would save the federal government money. Because if you think about it, someone is sick and there's medication that could help keep them well, limit the severity of that illness, heal them or cure the illness, and they don't take that medication, what happens is people become more and more sick and end up with an extreme illness, which is far more costly to treat. So this is a saving. This is an investment. It will return a reduction in healthcare costs if we make this investment. So it's vital that we both fund our healthcare system adequately and make sure that we're doing it in an effective way, which is to make sure people can actually afford the medication they need to stay healthy.
Chris, you have a question? Yeah.
Hi, Minister Singh. Mr. Singh, Chris Reynolds, Canadian Press.
Add a prime in front of that, and that'll be the future.
With so Mi'kmaq Chief Mike Sack is apparently calling for the resignation of Fisheries Minister Bernadette Jordan over her lack of engagement with the community, he says, and over her handling of the lobster fishery file in general. I'm wondering if this is something that you would support, or if that's going a step too far?
Well, I want to see the resolution of this, and it is absolutely fair for the Mi'kmaq chief and the Mi'kmaq Nation to raise deep concerns about the inaction of this Liberal government. But it is the Liberal government in total. The fisheries minister might be the minister responsible for fisheries specifically, but this falls at the feet of the Prime Minister. The Prime Minister of this country needs to take it seriously when Indigenous people are exercising their court-protected right, a right that was affirmed at the Supreme Court, and the responsibility lies with the federal government to establish how that right is put into practice. That how can a community be able to participate in a moderate living off the land in a way that is absolutely protected by law. So this is something that the Liberal government has to face. It is their responsibility. They have the power to fix this, and they have completely abdicated the responsibility by ignoring the plight of the people of Mi'kmaq.
The Bloc Québécois are poised to table a bill tomorrow that would require anyone who is applying for Canadian citizenship in Quebec to have a functioning proficiency in French rather than in just a professional proficiency in either English or French. Is this a bill that you would back, given that Mr. Blanchet says that French is under threat?
Well, I would start by saying we absolutely support the strengthening of laws to protect the French language, and we've called for the modernization of the French of the laws, the Languages Act in Canada, and for better supports for French language. Our approach is different, though, when it comes to new Canadians. We think that to grow the language, the French language, and to support people, we need to put in place better supports and tools for people to learn French. That's the approach that we would take, that if we put supports in place for francisation, for the learning of French, for that access, we'll actually see more people that can communicate and speak and learn the language. That is a better path than that's the path that we've taken and the path that we suggest.
Est-ce qu'on a le temps pour une autre question? Do we have time for one more question on the phone? Oui, I'll take one more question on the phone, operator.
There are no questions on the phone. Aucune question au téléphone.
I'm just going to add one more thing. I mentioned the deep concerns in Winnipeg, in Nunavut, in Indigenous communities. We're seeing really troubling numbers in the GTA as well, in Toronto, and particularly in Peel, and most recently in Brampton. And there's been a number of community leaders that are calling out, crying out for help, pleading in a desperate way that there needs to be help. Brampton has been underserved and underfunded and under-resourced, like many communities across this country, and they're in a desperate situation now. And so, again, we are going to continue to fight so that everyone in this country gets the help they need. The second wave has been devastating, and it has hurt communities across our country. It has impacted seniors again. It has impacted long-term care homes. And I want Canadians to know that we are going to be fighting for them.
Thank you. Ceci met fin à la conférence de presse. This concludes the press conference.